Republican senators huddling with President Trump today as they try to figure out what's next on health care. Will they really vote on a straight Obamacare repeal even though they know it'll fail? Then two lawmakers in Westchester County are here to talk about the latest in that housing settlement with the federal government and how County Executive Rob Astorino has handled this long, drawn-out case. And later, the subways are struggling with delays and overcrowding. You'd think the MTA already has its hands full. So why is Governor Cuomo now talking about purely cosmetic changes to bridges run by the MTA? Good evening and welcome to RFL. I'm Andrew Whitman, in tonight for Richard French. We start with lawmakers, Republican lawmakers, trying to bounce back from yet another defeat on health care reform. One of the plans that they were talking about, repeal and delay, well, it turns out it would knock 17 million people off their insurance in just the next year. And it would do the same to 32 million people over the next decade. Plus, premiums would soar by 25%, that just in the first year. All this coming out in the last hour from the nonpartisan Congressional Budget Office. Meanwhile, the president was still trying to work the politics. He hosted Republican senators for lunch at the White House today, and they tried to strategize and find a way forward.
President Trump hoping to revive efforts to repeal and replace Obamacare, inviting all Republican senators to the White House for lunch.
For 7 years, you promised the American people that you would repeal Obamacare. People are hurting. Inaction is not an option. And frankly, I don't think we should leave town unless we have a health insurance plan, unless we can give our people great health care, because we're close.
Senate Majority Leader Mitch McConnell facing a divided Republican Party, but making his own last-ditch effort, planning a vote to repeal Obamacare next week without an immediate replacement plan.
The Obamacare repeal legislation will ensure a stable, 2-year transition period, which will allow us to wipe the slate clean and start over with real patient-centered health care reform.
Even Senator Rand Paul, a repeal proponent, says it's not ideal.
I still favor replacement at the same time, but what we discovered is that Republicans don't agree on replacement.
The repeal bill may not even happen at all. 3 Republican senators have already come out saying they'll block any repeal measure from getting a vote on the Senate floor.
I do not think that it is going to be constructive to repeal a law that at this point is so interwoven within our healthcare system.
More on the status of healthcare reform now. I spoke with ABC News political director Rick Klein a little bit earlier today. Rick, the president is meeting with Republican senators at the White House today, trying to unite the party. Is there any sense from Republicans that there's anything the president can do to bring them together on this?
His latest is that he's asking that they stay in through the August recess until they get this done. But I'll tell you, there is no optimism in Senate circles or Republican circles more broadly about the president's ability to get this done. The votes are already established against this. Members of Congress would have to flip-flop and be in political peril for that, in addition to the peril for this health care vote. So President Trump's getting very involved very late in the process, and I think that's problematic as they try to game plan out an attempt to repeal and replace Obamacare.
This is, by my count, the 5th or 6th try for Trump care that has not gone through. Where the critics and the people who are looking to oppose it are probably wondering, how are we going to know if this thing is actually dead? When will we know that this thing is dead?
Well, approximately never, I think, is the issue that Democrats have to confront. As long as Republicans control in the House and the Senate, they have the possibility of bringing this up. All of the deadlines so far have been self-imposed. Now, nothing gets easier about the politics as you get closer to the midterm elections, but at least theoretically, hypothetically, they could bring this up at any moment up through next year. So I don't think that the opponents of this will be able to rest on their laurels at any point, and there will be efforts. The question to my mind is, at some point, does the president give up on a Republican-only plan and allow some of the bipartisan shoots to start to spring toward the air? Because there are a lot of Democrats and Republicans both that are willing and able to work on this. Just they can't do it as long as the strictures are in there now of Republicans trying to do a repeal bill based only on Republican votes.
Toward that end, Rick, we've gotten 3 public approaches from the president on Twitter in the last couple of days. Repeal and replace, which is what he's focused on today at the lunch, straight repeal, and then this just will do nothing and let Obamacare die. If you're a Republican member of the Senate, do you have any idea what this president really wants?
You don't, and you have to conclude that he isn't super dialed into the political realities that they face or into the policy realities of this bill, because that is such a scattershot approach that ends up accomplishing nothing. And that's been one of the sources of frustration, is that when there has been presidential leadership, it's been all over the map. and it's not taking them in a direction that they can all pull behind. You're hearing a lot of critics come out publicly now and say he should have been doing more to message around this. What about those big campaign rallies? What about going to the home states of some of these senators, places that you won pretty widely last fall, and making the case for this instead of just explaining defensively what it doesn't do, and just hope that your own persuasive powers make it happen. So there's still a chance for a change in strategy, but it's getting pretty late. I think this bill is essentially dead. It's a zombie walking around, and President Trump has to realize that at some point.
The president's comments yesterday about let Obamacare fail and potentially put people in harm's way to score political points. First of all, have you seen a president say anything quite like that you can recall?
Nothing that I can recall, no. I'm talking about it with colleagues. We couldn't come up with a direct historical analogy of a president talking that way. I mean, clearly, millions of Americans depend on Obamacare, depend on the insurance market reforms that are part of it, and depend on the subsidies and the Medicaid expansions and the support they get, frankly, from the federal government on down. And the idea, at least, again, extending out a hypothetical, that the White House would allow a system to fail that affects millions of Americans is pretty unfathomable. And I don't know that's quite how he meant it, and the White House aides haven't backed that up with any specific actions, but he's leaving it out there as a threat. He said it very clearly, and it's one of the many strategies this White House is pursuing now. If
that's the policy he pursues, let it fail, then doesn't it really become something of a jump ball in terms of the blame game on this, trying to convince Republicans that somehow he's responsible for the death of Obamacare? I mean, it really becomes on who can sell it better, right?
Yeah, and I haven't met many Republicans who are comfortable with taking that gamble. They know that if you're in charge of the House, the Senate, and the White House, it's very hard to blame the other party for something, even if it is called Obamacare, even if it is a relic from the Democrats. President Trump declared yesterday that he's not going to take the blame for it. It's not that easy. That's not how it works, and obviously voters get to decide that, and that'll be part of the political messaging machine. But clearly, if you're a person in power, and your party has full control of Washington, it is difficult to look at the other side and say, actually, it's their fault, not ours.
Heard some concerns that the president may seek to undermine Obamacare. How would he go about doing that? What would we see that would indicate that he's trying to do that?
Well, there are a range of ways that the Department of Health and Human Services and directives that come from them to states and medical providers can either help or harm. The timeliness of subsidies is a big piece of it. Some of the details on how you help hospitals, reimbursement rates. There are levers of power. Just even communications about signing up. That's something that the federal government has done in the past, setting up that website, much maligned website that allows people to find the right insurance exchanges and compare prices. You can shut all that down theoretically if you don't want to support it. So he could undermine a law that's already got problems and make it quite a bit worse for the people that are depending on those services.
Senate Majority Leader Mitch McConnell says he wants a vote on straight repeal, even if he knows he can't pass. Why would he put that up for a vote?
Well, actually, I think he said that on the request of the president and the vice president, that we're going to have that vote next week. I think for him right now, it's as much about showing as telling. He can tell the White House and he can tell his own members we don't have the votes, but until you show them that, they're at a point where they're not going to change this. They've been doing this. It's consumed the last several weeks. It could easily consume the next several months. They need to move on at some point, and I think that Mitch McConnell's view is that you're going to have to put people on the record at some point on this. It was a campaign pledge. Let people either back it up or not back it up, and then let the chips fall, and then move on to other things, because this isn't the only thing that the Senate and the Congress need to do this year.
Rick Klein, ABC News political director. As always, Rick, thanks very much.
Hey, thank you.
And up next, we'll take a look at how the healthcare turmoil in Washington will impact local residents, businesses, and hospitals right here at home.